Hello, everyone. Today we are so honored to have with us someone who we have all been following since the first case of COVID-19 hit the US, someone we all look up to for all information regarding this pandemic, vaccines, and now the path to return to normalcy. He has been a beacon of hope, disseminating timely information and working incessantly to keep us all safe. So it is my privilege to have Dr. Jeff Duchin. Dr. Duchin is a professor of medicine with allergy and infectious diseases and an adjunct professor of epidemiology and a health officer with King County Public Health. Thank you so much, Dr. Duchin, for joining us today.
I'm so happy to be here with you, Mayor. Thank you for inviting me.
So, Dr. Duchin, the COVID vaccines are here and they're bringing so much hope and optimism to the community. However, there are still a lot of people who are hesitant, who are fearful about the vaccines and their possible side effects. So, what would you say to those who are hesitant or skeptical and debating?
Thank you, Mayor. I would say it's good to have healthy skepticism, and it's always important to think about your health and your health care, and vaccinations and medications are part of your health care. So I encourage you to always think critically about what you do for your health. With respect to these vaccines, I can tell you that they were studied comparable to any other vaccine that gets approved or authorized by the US Food and Drug Administration, tens of thousands of participants in the clinical trials, and that they became available more quickly because a lot of administrative red tape was cut. So the FDA required very intensive safety monitoring. They required large trials, larger than some other vaccines have done. And since these vaccines have been licensed, approximately 82 million Americans have received these vaccines. And in King County alone, over 500,000 people have received these vaccines. And we've seen a tremendous drop in severe illness, hospitalizations, and deaths among our older adults, which is extremely gratifying. And we have not seen nationally any worrisome safety signals. Now, it's important to note that with any drug, any vaccine, that very rare events, the kind that happen only after millions of people receive the drug, can happen. And that's something that is continually being monitored for. There are more safety systems in place looking at these new COVID vaccines than have ever been used for any vaccine previously. And the Centers for Disease Control and the US Food and Drug Administration are constantly reviewing reports that they get of possible associations. And anytime something is flagged, it's investigated. So I can tell you that this vaccine's received a lot of scrutiny, that, or I should say these vaccines, there are 3 now, that they're all safe and that they're all effective.
Yes, thank you so much, Dr. Duchin. That is such great advice and invaluable information for the community.
You're quite welcome.
So, Dr. Duchin, with the Johnson & Johnson vaccine here, public health experts and the government are hopeful that one jab can do the job. However, people really have questions about the efficacy comparisons, and some people would rather wait for the stronger vaccines like Pfizer and Moderna. So, can you please walk us through the advantages of the J&J vaccine and why this can actually be a game changer?
Absolutely. First thing to understand is we really can't compare one vaccine to the next head to head because they were all tested at different times in different places and with different populations. So the mRNA vaccines, which are the Pfizer and the Moderna, came out first. Very high vaccine effectiveness reported in the mid 90s. And then at a different time in different countries, the J&J or Janssen vaccine was tested and came out with slightly lower numbers. But that doesn't mean that we can compare directly because the groups that they were tested in were different and they all may perform differently when tested in the same groups. So, for example, the J&J vaccine was shown to be 85% effective against severe COVID-19 globally, including in the United States. So all three of these vaccines are highly protective against severe disease. And during the clinical studies, no one was hospitalized or died that received any of these vaccines. And those are the most important outcomes that we're concerned about, preventing hospitalization and death, the most severe outcomes. The J&J vaccine was shown to be 72% effective against less severe disease. And so what that means is the milder cases, maybe some symptoms, but not severe. Again, we can't compare these numbers directly with the J&J, Moderna, and Pfizer, but we can say with confidence that all three are highly protective against severe disease, such as hospitalization and certainly against death. Now, there are some important differences, though. Those are the similarities, all highly effective. But the important differences are that the J&J vaccine is one shot, as Mayor alluded to. Some people call it the one and done. And that's very attractive because for both Moderna and Pfizer, those are 2-dose series. And the second dose is either 3 or 4 weeks after the first. Now, the other point that I think may be attractive to some people, in addition to being a 1-dose series, is that the 2-dose vaccines, the mRNA vaccines, tend to have some pretty prominent side effects in a significant number of people after that second dose in particular. So I'm talking about things like fever, muscle aches, feeling weak and tired, chills. Some people feel they need to take a day off of work for a day or so until they recover from these expected side effects. Now, these are not, serious. They don't cause any long-term health effects, but they're uncomfortable for a significant number of people who get these 2-dose vaccines. And we do tell people to plan to take a day off or two after that second dose, just in case. And many people may not need that, but some do. So with the J&J vaccine, the 1-dose vaccine, the frequency of those types of side effects is much lower. And so it has convenience, 1 dose, and it is less likely to cause some of those uncomfortable side effects that many people get after the second dose of the 2-dose vaccine. And again, all three are highly effective in preventing the serious outcomes that are most important.
Yes, thank you, Dr. Duchin. I'm sure that people will find this really informative and that this will help dispel their doubts.
Great.
And Dr. Duchin, you recently said, I do think we can achieve a very meaningful level of population level immunity so that our community will be protected from severe outcomes, hospitalization, and death, but not likely to be able to completely stop the virus from transmitting from person to person. What does this exactly mean for the community?
Yes. Thank you, Mayor. So what this means is that I don't think COVID-19 is going to go away. In other words, in order to eliminate or eradicate this virus, we would need to have everyone vaccinated, and we would need to make sure that that vaccine was highly, highly effective, and that vaccine also prevented mild or asymptomatic infections so that people who don't get sick but may still be able to have an infection that just causes the virus to be in the nose or throat, can't spread it to others. That also means that we would need a vaccine that produced very long-lasting high-level immunity, and that if it didn't, or if the virus evolved as we see it evolving currently, new vaccines would be necessary, and we would need to make sure that over time, everybody continues to get vaccinated. I think that it's unlikely, particularly since we don't have a vaccine for children, which make up 20% of the population now. I think it's unlikely that we'll ever eliminate COVID-19 as a health issue, but what we can do is minimize the severity of that health issue. So I think it's likely the virus will continue to circulate in humans, and that we will be able to, through vaccination, prevent the most serious outcomes of infection from that virus. The other challenge is that just globally, this is a global problem. And in order to even think about, not having this virus locally, we'd have to ensure that it wasn't present anywhere where it could be introduced into the United States. And we travel, Americans travel, we go all over the world and we return, get infections, come back all the time. If this virus is common elsewhere in the world, it would be likely that it would be reintroduced into the US on a regular basis. So for that reason, I really don't think that we're going to make this virus go away entirely through vaccination. However, I think we'll be able to control the most problematic aspects of it, the severe illnesses, the hospitalizations and deaths, if we get vaccinated.
Thank you, Dr. Duchin, for there's just so many variables with regards to the virus and the new variants out there. And we really look up to King County Public Health for guidance and information. So thank you for shedding light on herd immunity.
You're quite welcome.
Dr. Duchin, right now there's kind of an optimism versus uncertainty about how long will the immunity last after the vaccine. So do you think that people will have to get boosters in the future?
Yeah. So you raised a good issue when you said variants, that I mentioned the virus evolving, and that's really what the variants are. It's where the virus evolves in a way that lowers the immune protection from the vaccine. Those are called variants of concern. And so there are two issues with respect to how long protection from vaccine might last. One is under the circumstances of the virus not changing, and one is under the circumstances of new variants that change and are less likely to be susceptible to vaccine-induced protection, so that the vaccines may be slightly less effective against a new variant. So I think it's, with these new vaccines, to know for sure, we just need to have time to observe people who've been vaccinated and see if they become reinfected. That's the most accurate way to answer that question, and we just haven't had enough time yet. Based on the immune response that people get after vaccination, it's likely that protection will last many months and possibly years or longer, but there's no way to tell quite yet. It will depend on how the virus evolves and the nature of that protection over time. And different people may have slightly different responses to vaccinations. Some may get slightly longer protection, some may get less, depending on age and things like underlying medical conditions. And all of this, is something that will need to be understood and studied as we have more people vaccinated and then exposed to the virus, and observe to understand whether those people are still protected or they begin to get infections, and whether those infections are serious infections or just mild infections. So I would say at this point, the best guess is many months, possibly years, but it's still, something that is not known with certainty.
Thank you. Yes, we will definitely hang on to the optimism and hope that things will return to normal gradually.
I think things will return to normal, and I think vaccines are going to be a big part of that, but it will take a little bit of time.
So, Dr. Duchin, you said that we can't let our guard down against the variants. Why are the COVID-19 variants proving to be an Achilles heel for infectious disease experts? And do you think that this virus will continue to mutate?
Yeah, thank you. Viruses evolve and mutate normally all the time. And most of those mutations don't really mean much with respect to how they affect humans. They're just meaningless mutations. And the virus, by all intents and purposes, affects us in the same way with respect to illness, severity, duration, and so on. Sometimes the virus mutates in a way that makes it more severe with respect to human illness, or makes it more transmissible. In other words, it spreads more readily. And what we're seeing with some of these new variants is that they have those characteristics. They are more contagious. They can spread more readily from person to person. So if I have the virus, I'm more likely to spread it to someone else, and someone who comes in contact with me would be more likely to get infected. So that's a problem right there, more contagious. And then secondly, some of these variants can cause more severe illness, so more likely to make you seriously ill, and some do both. And there's a B.1.1.7, the most common variant. It's called a variant of concern, and that means that it has some of these characteristics that affect human health. This variant is becoming very common in our area here in Washington State, and also in many parts of the US and in many parts of the world. And that's a concern for us because the virus currently is now spreading more rapidly than it had been in the past, and it's more effectively spread. And that means we need to be very careful about the prevention measures we take to stop that type of spread in the community. The same measures that we took previously may not be as effective against a virus that can spread more readily. So really understanding how the virus spreads and taking all precautions to protect one another is very important right now until we get enough people vaccinated to make sure that all of our population is protected. Right now, we have a great deal of our older folks, almost 80% of the 65 and older across the county have been immunized. Now that's different in different subgroups of the population and in different areas of the county, but overall we're looking at 80% protected for 65 and older. But we still have many younger people who need to be protected as well because COVID-19 is not always a mild infection in younger people. Sometimes it causes serious illness, and sometimes it causes long-term symptoms. You may have heard the term long COVID or long haulers. And these are very serious symptoms sometimes. It can be neurological, related to thinking, headaches, weakness, cardiac disease, difficulty breathing, and so on. So we really want to make sure that we minimize the spread of this virus as much as possible in all age groups. And that means with the variants, increasing the level of precautions that we've been taking against the previous viruses in order to achieve the same level of protection against spread.
Yes, I'm sure your message will really clearly explain things for the community. Thank you for this information.
You're welcome.
Dr. Duchin, you have stressed a lot on the non-pharmaceutical interventions like masking and especially ventilation. What would be your recommendation about safely opening schools for kids?
Thank you. I do want to just step back and make a little bit of statement about COVID prevention in general. Masking is very important, and particularly these masks have to be well made and snug fitting. Because if the air escapes around the sides or the top or the bottom, that's not very effective. COVID-19 is an airborne disease. It spreads through the air, so you can think of it like smoke, incense smoke, cigarette smoke, or a perfume. It floats in the air. And so it can get around the sides of a mask that has gaps in it quite easily. Although when people wear masks, it reduces the amount of virus that can get out. It gets out of the body just through speaking, and speaking louder and singing and exercising produce many more viral particles and put them in the air. And for that reason, masking and ventilation, including improving the ventilation in air spaces, indoors, in closed rooms, by opening windows, opening doors, and paying attention to the heating, ventilation, air conditioning systems, that they're operating properly, that they're bringing in outside air, that they have the right types of filters, can all reduce the risk and are very important in addition to vaccination right now. With respect to schools, it's the same. Kids really, although they are much less likely to get serious disease, can be infected with COVID-19, and they can spread it to adults. And so it's important that when kids come back to schools take all the precautions that are outlined in the guidance from the Centers for Disease Control and Prevention, which recently updated the guidance. It's quite good now. It's quite extensive. It includes things like, keeping kids separated, cohorting them into groups so they don't mingle with other kids throughout the day, but stay within their class group, making sure that ventilation is optimal, and of course, wearing masks. and also information about how to keep teachers safe and how to go to and from school safely, and about after school activities, because it's not just the classroom that we have to think about when school comes back into session, but all the other activities that kids do in the school environment, extracurriculars, band, sports, and so on. So we need to pay careful attention to making sure that we take all these steps to prevent COVID transmission. And particularly, I think it's important for people to think about masking and ventilation in that context.
Thank you, Dr. Duchin. I know that kids are really desperate to go back to school in person, and I feel that families watching this will feel more comfortable sending them when schools do reopen.
I hope so. And if families have questions, it's really um, the best course to talk directly with your school leadership, because they're the ones who can tell you in detail about what that school is doing, what that school system is doing to keep the children and the staff and everyone in the school environment safe. There's clear guidance that should be followed, and you should feel comfortable that your school is taking the steps that are required.
Dr. Duchin, I would like to request you to talk a little about the new CDC guidelines. Some people are a little confused about who exactly can visit whom. Should people meet other people indoors after their first shots?
Great. So, as I said, there's still quite a bit of COVID out there. So, we can't really relax completely at this point. Although many of our older adults are vaccinated, not all are, and older adults are at very high risk of hospitalization and death. So we still need to take precautions. So first, let me explain what it means to be vaccinated. Fully vaccinated is when you've had 2 doses of the 2-dose vaccines, like the Pfizer or Moderna, and you're 2 weeks after that second dose. At that point, your protection is considered to be matured. And then 2 weeks after that single dose vaccine, like Johnson & Johnson's vaccine, you would be considered to be protected. So once you're 2 weeks after finishing your series, at this point, it's considered to be safe to gather indoors with other people who've been vaccinated without wearing a mask and without having to distance. And you can gather indoors with unvaccinated people from another household without masks, unless there's a high risk person in that household, someone at risk for severe disease. So even though the vaccinated people are protected against severe illness, there's still a possibility that a vaccinated person could get a mild or asymptomatic infection. And that risk is lower. It's much lower with vaccine, but it's probably not zero. So we don't want a vaccinated person to unknowingly have an infection that they spread to someone who's at severe risk. And that's why the recommendation is not to take your masks off and to continue to distance when vaccinated people are in the company of someone else who's at high risk for severe illness, or around other people who have not been vaccinated, who are at high risk. And another advantage of being vaccinated is if you do happen to be around someone with COVID, you're no longer required to quarantine or get tested unless you get symptoms, which would be unlikely. So that's a benefit as well. But when you're in public, if you're vaccinated, when you're gathering with groups, we still suggest masks are important, again, because not everyone in that environment is vaccinated, and because even vaccinated people at times can potentially spread the virus, although that risk is much lower. Until we get more people vaccinated, it's best to take these precautions. Gathering in large groups is still risky, and travel is a bit risky also. So we still do recommend people try and avoid unnecessary travel until we just get more of the community vaccinated. And these recommendations will change and will evolve over time as more people get vaccinated. But I think it's great news to say that vaccinated people can gather together. They can gather with another family, another household that has unvaccinated people, as long as there's not someone there who's at high risk for illness. If there is, it's best to continue to wear a mask and do that social distancing of 6 feet.
Thank you, Dr. Duchin. This is such great information, and it is so important for people to not let their guard down even after they're vaccinated.
Absolutely.
Thank you so much, Dr. Duchin, for joining us today. I really appreciate it. This was amazing information for the community, and I'm sure that members of the community will really get their questions answered and clear up some of their concerns about the COVID vaccines. So thank you so much.
It was my pleasure. I thank you for doing this and sharing this information with your community. And you know how to get in touch with us if there are questions that I didn't answer.